Federal Drive is presented by GEHA, Government Employees Health Association, proudly providing health and dental benefits to federal employees and their families. Visit GEHA.com.
Senate lawmakers are calling for an independent audit of the Defense Department's multibillion-dollar TRICARE pharmacy program amid concerns that its longtime contractor, Express Scripts, may have a financial incentive to steer beneficiaries toward its own pharmacies. Federal News Network's Anastasia Obis is here with more details. Anastasia, thanks for joining me.
Hi, Terry.
What exactly is Congress concerned about here?
Yeah, so we have Express Scripts, the contractor that manages the TRICARE pharmacy program, as the pharmacy benefit manager, and we will probably touch a little bit on this. The way it's set up is a little different from commercial PBM models, and DoD essentially calls itself the PBM. But as the manager, Express Scripts decides which pharmacies can participate in the network, and it also decides reimbursement rates. However, the company also operates its own mail order and specialty pharmacies that participate in the TRICARE network. That, of course, puts it in direct competition with other pharmacies in the network, and some lawmakers have been raising concerns about this potential conflict of interest. Here's Senator Elizabeth Warren.
That means that Express Scripts both provides pharmacy services to TRICARE members directly and sets the reimbursement rates for itself and all of its competitors. That gives Express Scripts an incentive to under-reimburse all of the competing pharmacies and inflate its own payments. So, how is that deal working out for the taxpayers? Express Scripts reportedly charged DoD $484 more on average for generic drugs dispensed by the Express Scripts owned pharmacy. Meanwhile, Express Scripts has offered unaffiliated pharmacies such terrible terms that since 2022, nearly 13,000 retail pharmacies have just left the TRICARE network. They've just said, we can't be part of this.
Anastasia, Express Scripts has been the contractor here for over 20 years. Why is this a concern now?
Yeah, just like you mentioned, they've been administering TRICARE pharmacy benefits for like 23 years. But in 2021, they win this 8-year contract worth up to $4.3 billion. And this new contract allowed Express Scripts to reduce the minimum number of in-network pharmacies from 50,000 to 35,000. So since then, Express Scripts proposed reduced reimbursement rates and basically pushed a lot of pharmacies out. As a result, like Elizabeth Warren mentioned, about 13 to 15,000 pharmacies exited the network, and most of them serve like rural areas. And it's been a big issue. Here's Dr. Michael Lanford. He owns a pharmacy in New Mexico, which is close to the Air Force Base.
After ESI was awarded the T-Farm 5 contract, they drastically reduced their reimbursement rates, such that I would have lost almost $9 on every prescription I filled before overhead, before any other expense. That would have been catastrophic for our business's viability and for all the other patients that we serve. No contractor should be allowed to referee a game while also competing in it. Military families experience the consequences while the contractor reports that the system is working just fine. Congress can and should correct this, require an independent audit, measure real pharmacy access, require transparent and sustainable reimbursement, protect patient choice, and establish conflict of interest safeguards that require a non-vertically integrated manager.
It's very complicated. However, DoD wouldn't release the terms of their contract with Express Scripts to Congress, saying that information is proprietary. So Congress doesn't know the terms. But the lawmakers obtained a copy of the contract that pharmacies were required to sign back in 2022 to remain in the TRICARE network. So one of the provisions in the contract basically allows the contractor, Express Scripts, to adjust what the contractor pays pharmacies after a claim has been processed. Express Scripts denies any involvement in practices like spread pricing, which is basically charging the insurer one price paying the pharmacy a different price and then keeping that difference. Here is Greg Raybould. He is the vice president of the American Pharmacy Cooperative.
What I would say is that is, in about 20 years of practicing law, that might be the biggest smoking gun document I've seen in a hearing, right? Because what that means is they get to do post-adjudication offsets. So what they reimburse a pharmacy at the point of sale, they get to move it around. What I would say is this: when you take that provision, which gives them the right to move money around after the fact across plans, it's essentially, we're talking about what? A complex shell game. We're talking about a Fortune 20 company playing a shell game that you see on the street corner in any city.
So, Anastasia, what has DoD said in response? Those are some pretty significant claims.
No, absolutely. So first of all, DoD requires the contractor administering the TRICARE pharmacy benefit to also operate its own pharmacy services. So this kind of vertical integration. They're also saying that this contract is different from civilian models. DHA uses a pharmacy benefit administrator rather than a traditional pharmacy benefit manager. It essentially calls itself a PBM, and the DHA pays the contractor a fixed fee per prescription filled. So they're saying they can't really generate revenue from price of drugs themselves. However, there's a lot of pushback, and we talked a little bit about it. Let me give you an example. So, for example, mail order pharmacy, it's about $14 copay for a 90-day supply, and you have retail pharmacy, it's about $16 copay for a 30-day supply. So, as a customer, you're like, okay, good deal. But the reimbursement picture is different. Express Scripts reimburses its own mail order pharmacies at the full statutory ceiling of $14, but they're reimbursing retail pharmacies sometimes as low as 65 cents per prescription. So that's kind of the issue.
What do you think happens next? Will the Senate direct an audit?
So yeah, they want a full audit. Actually, Assistant Secretary of Defense for Health Affairs promised the committee to conduct an annual review of the contract, but Congress is still waiting. So the Senate Armed Services Committee put that requirement in the fiscal 2027 NDAA. The Defense Department is also planning the next generation TRICARE pharmacy contract. So lawmakers want full transparency on this program, and they also want DoD to flatly prohibit vertical integration in the next contract. So it theoretically provides coordinated care, but of course it creates this conflict of interest that we were talking about.
That's Federal News Network's Anastasia Obis. Thanks for bringing us this story.
Thank you, Terry.
You can find the full details in her story at federalnewsnetwork.com.